idea came, there were donors from Europe, and they were sending donations of medical equipment and medicines. The church had already formed what is called the Medical Bureau, Uganda Protestant Medical Bureau. The Catholics had their Uganda Catholic Medical Bureau. And later on, they said, why don't you form one organization instead of having a Catholic and a Protestant? Why don't you have a joint one? So we agreed and we formed the joint medical store.
So getting at that time a whole drum of medicines that then you could share around to hospitals was a big thing. And it provided access to medicines, which I think would not have been there.
During the Konyi War, it was quite difficult to run the hospital. First of all, electricity from Jinja was not there. That was the first thing to go off. And then the supply of drugs. We either used to sit and read over a radio call, a list to somebody in Kampala, who then take our lists to JMS.
I was embattled in an area of handling women with obstructed labor, children with limited supplies. But the encounter of Joint Medical Store improved this. And Joint Medical Store was able, through a partner, to fly regularly supplies to Kitgum.
Joint Medical Stores is recognized by government as well as the national health policy as a very important institution in supporting the health sector to achieve its objectives. And from time immemorial, the health sector has been working with the joint medical stores to supply medicines and health supplies.
We have visited their stores. They comply with good storage conditions. They are employing good distribution practices. In terms of compliance, I would say Joint Medical Stores is one of our model clients.
So automatically we had to introduce planning, because as a manager you have to plan. We were lucky a bit because I had trained many people in Europe before I retired in the European industry, and I had a complete syllabus for the profession of a manager. We developed a complete training program for the joint medical store management, and that is how we bit by bit developed the middle management level and also the management team, who were supervising the middle managers and who were supervising the quarterly reporting and things like that.
Joint Medical Store was growing, but not as it is today. Like my first office was in a container. I remember it was very hot because Kampala is really a hot area. And then in 1998, that's when JMS also started a standard building.
One of my roles later on was I coordinated the move from the old store. Yes, so I was based at the new store trying to make sure everything was in place. So that when the medicines came in, I was the one who was receiving them at the new warehouse.
The mandate has continued to evolve considering the needs of the health facilities to the current mandate of basically coordinating all these facilities and making sure that we are linking them to the national system, but also supporting them to make sure that they are actually functioning where they should be functioning.
Since then, we have really built on what had been done over the years. Importantly to note, I think, is that we have, over the last several years, built a stronger partnership between the Joint Medical Store and the bureaus, between Joint Medical Store and our customers.
The innovation that Joint Medical Stores undertook to ensure that medicines are delivered to the doorsteps of the health facilities and they are received by the people at the health facility and registered in a way giving room for accountability to the entire nation that we have delivered these commodities and they have been received and they have been acknowledged.
They monitor that on our behalf and they account for those drugs on our behalf. And the way they do advocacy even on our behalf to government, when they give the drugs and they account for them, we know that the government appreciates our work through Joint Medical Store after they have accounted.
What we have enjoyed, one is quick delivery of services. Then their drugs, they are in the right condition. Transport is always free and timely. That is in delivery still.
For joint medical stores, they've thought it wise to come nearer to the people. So the cost of services reduces because then transportation, delivery becomes very easy. So in terms of efficiency, it is quite efficient for people.
Particularly, we are happy with the medicines because we know that they are very carefully checked and we never get counterfeit drugs. We're able to rely that the treatments we give to our patients are going to work.
We spend a lot of time and investment in ensuring that every batch of products that we receive at JMS is subjected to a quality assurance process, including quality control tests. This we do even if and despite the fact that NDA, or the National Drug Authority, has already done quality control. So we do have a mini lab, and where some tests are beyond the mini lab, then we do send samples to reference laboratories, but ensure that the quality of products at the time we receive them in Joint Medical Store are of the right quality. One of the biggest challenges in the pharmaceutical sector in this country is that even if products are received when they are of the right quality, the storage, the handling does not maintain that quality throughout the chain.
We felt it was necessary to buy from JMS, aware that the products were of high quality, at the same time they were affordable. So in 2010, I started bring together all units. They could make their orders, and as office we could go and purchase on their behalf. In 2013, we realized that it was not enough. We entered into a partnership with JMS and we started an outlet here in Masaka.
Bishop of Fort Portal requested me to begin a drug store in Fort Portal to help the diocesan health units to get good drugs, to get quality drugs, and to work with Joint Medical Store so that they can also benefit in the Western region, because not many health units could go to get drugs from Kampala. So they were limited, but when we opened here, now even the small health units like Health Center 2, Health Center 3, they were able to access good quality medicines.
We have increased our portfolio of projects as well as strengthened our system for management of projects, meaning those activities in which we are supporting either the government or donors to distribute to warehouse and distribute free commodities to health facilities.
There is some surplus of some funds which they have been offering to the Uganda Catholic Medical Bureau, which has been turned into scholarships for some medical personnel, like nurses, doctors, for upgrading their different areas of their qualifications. And I think this is a great asset of improving on human resource.
We have been trying to work with Joint Medical Store, for example, every year to improve on water supply for facilities that are outside the national water grids, providing for them rainwater harvests and the rest. That in itself improves hygiene and improves the water presence in the facilities, in the delivery. You cannot have a delivery room, a maternity service without water.
Initially, you'd see that facilities would have to buy with cash. But now we are seeing a situation where JMS is able to advance facilities with drugs for either 3-month supplies, and then facilities are able to come come in and pay later.
Most of the time, we receive goods on credit. We make our orders, there is no money at hand, but we are able to get all these items that we require for the hospital. Then we are able to pay later after we have consumed the items.
And because of that, we are now at a stage where drugs are available in the pharmacy, which was not so in the past. We are at a stage when people come in and they are not disappointed because they find the drugs. And we believe it is one of the reasons why people continue coming in, because we have the drugs and they are at a slightly cheaper rate than maybe outside in the pharmacies.
Just last year, the hospital was out of financial resources, but there were also drugs out of stock. We were on the verge of saying we could also close the hospital because a hospital without drugs. So I called the executive director, Dr. Baguma, and just said, we need joint medical stores. And trust me, in less than a minute, they sanctioned a truck and ran to come and save the day. That is unforgettable.
Before we would buy from any private company, sometimes there was a lot of ordering of also drugs from abroad, so you have really probably to load the container and bring your own drugs. But with JMS around, the service came close to us. It was a good service. We were getting quality products from JMS, and it was near and relatively cheaper than what we were doing before.
We have been very grateful that there is now a branch in Umburara. Previously we had to do everything through Kampala, and the Umburara branch is much more accessible to us. It's about 2 hours drive from here. And so sometimes when we've had urgent needs for particular medicines unexpectedly, we've been able to liaise with colleagues in JMS in Umburara and get the medicines urgently delivered.
The access of quality medicines and other health supplies has greatly improved all our health facilities because they can easily walk to joint medical store, which is near to them, and they get those medicines.
JMS has given us capacity building in many areas, mentorship of our maintenance staff, mentorship of our stores, and also trying to educate our people in administrative skills.
They have supported technical capacity building of our key staff in the hospital in many sectors: drugs and stores management, equipment management and maintenance. They've even done a few donations over the years, the hospital. So you cannot talk about growth and development without talking about joint medical stores.
Currently we are manufacturing a product, as you may know, Replenish Plus, in partnership with Doctor's Choice. And we are working on a number of initiatives to expand the products that we are producing.
The first product, Replenish Plus, was manufactured in 2018 and has proven to be a very successful nutritional product in the East African market. It is currently prescribed by all major hospitals in Uganda and all the major pharmacies. At the end of 2018, the government of Uganda selected Replenish Plus as the nutritional product of choice to be given to children who are affected by Nodding syndrome. More recently, the government of Uganda have chosen to use Replenish Plus as an adjunctive product for antiretrovirals in Uganda.
Well, we face a number of challenges. Uganda has porous borders, and maybe our controls are not yet where they need to be. I know a lot of work has been done by India and others to ensure that the products are of the right quality, but we still get low quality products on the market. So it means we have to spend a lot of money and time in quality control, ensuring that we have the right quality of products to our customers. We have an enterprise resource planning software called IFS, for which we have just upgraded and we will be expanding that or looking. Part of that upgrade has given the ERP an ability to actually link JMS with the facilities. So we'll be working with the facilities to make sure that we can have a system where the facilities are able to know what is available at JMS. We're also able to know what is available or lacking in the facility, so that we can be able to serve them better.
Very high congratulations to Joint Medical Store and to the bureaus that they continue to serve the people of Uganda through their health facilities as they are doing now, and hope even better in the future.
Allow me first of all to congratulate Joint Medical Stores for 40 years of service to the people of Uganda, 40 years of great innovation, and 40 years of commitment to the health sector.
We want to thank our customers and our partners that have worked with us to bring Joint Medical Store to where it is today. And would like to encourage them to continue to support Joint Medical Store. On our part, we are committed to continuing to build efficiency and ensuring that we can serve them to the best of our ability.